questions and answers. For those of you who may not know me, my name is Dr. Nita Ahuja, and I'm the interim director of the Yale Cancer Center and physician-in-chief for Smilow Cancer Hospital. I took this role over in March 1st when Dr. Charles Fuchs left the institution. My other job before this was chair of the Department of Surgery, and I continue to do that. But it's been my pleasure to take the helm from Dr. Fuchs' able hands, and I look forward to tonight and getting to know all of you and spending this evening together. I also hope that this forum becomes one that we can continue on to connect with all of you, as this is an important forum for us to learn bi-directionally on what things are going well and what things perhaps we can pay our attention to. Next slide, Renee. So this month, it's really some exciting news. This is Oncology Nursing Month, and May 6th was National Nursing Day. I think we can all say that living through the past year and almost every day for our cancer patients, that the 400 plus nurses who deliver care at the Smilow Cancer Hospital and our 15 ambulatory sites around Connecticut and in Westerly, Rhode Island, we couldn't deliver the care without all of our nurses. So they're central to our patient care teams, and we thank them all for all that they do. I also wanted to acknowledge that, if you will move to the next slide, Renee, is May is also Bladder Cancer Awareness Month and Brain Tumor Awareness Month. And as some of you may know, but Yale Cancer Center has done some phenomenal breakthrough advances in bladder cancer. Especially, I want to point out the work of Dr. Dan Petrolak, who just last year had the first FDA-approved therapy for advanced bladder cancer, PADCEV, or enfortumab vedotin in late 2019. And the follow-up studies of these new drug combination and targeted therapies are currently continuing in clinical trials. And for brain cancer, Smilow Cancer Hospital, the Chenevier Family Brain Tumor Center is also leading the way with advanced surgical options for our patients, especially in intraoperative MRI suite, often able to schedule surgery on difficult to treat brain tumors, patients who may need a second operation on brain tumors, and also awake surgeries to protect those critical functions of the brain. Our neurosurgeons partner with neuro-oncologists and other team members to provide multidisciplinary cancer. And I think these are just two cancers, but I thought it was nice to highlight these 2 months for you tonight. Next slide. Now here's some nice sort of news. You know, as we hopefully many of you are getting vaccinated, I thought it was nice to share some COVID data. I know we're joined by Dr. Balzasek, who will share some more. But just to give you some statistics, that over 25,000 of our people, employees and medical staff, have now been vaccinated. And if you look at the members of the public vaccinated, it's approaching close to 200,000 since March 2020. And if you look at our system, we've taken care of around 12,000 patients overall since the pandemic started in March of last year. And in the past week alone, there were 219 patients. I think it's exciting to see that those numbers are dropping, but it's also important to reflect back on the last 14 months and think about what we have done collectively with as a system. And certainly our mortality rate is the lowest in the state. And I think it points out all the hard work of our team members in taking care of our patients. Next slide. And then if you look at activity, I think I'm really proud to say that all of our teams, that we were able to offer care to treat all of our patients. These are patient volumes starting in April of last year. You can see them in dark blue. And we continue to take care of our patients even when perhaps things were very difficult in the early days, and have continued to do so. I do think we all recognize that there was some delay in getting to cancer screenings, and we're seeing a catch up, especially in the last few months, where more patients are coming in. And I do encourage everybody to catch up with their cancer screening, whether it's mammograms or other types of screening. And I hope you know that we're all here to make that available to you. I have a wonderful agenda tonight. Moving to the next slide. As I mentioned today, we're going to start out with talking about cancer care and COVID vaccinations, and what does it mean for immunosuppressed patients with vaccination. So we have our very own Dr. Kevin Billingsley, who's spoken at this forum before. He's our Chief Medical Officer, and alongside we have Dr. Thomas Balzasek, who is the Chief Clinical Officer for the health system and the CMO for Yale New Haven Hospital. Following that, we have a delight with the integrative medicine team that really think about all of your health and how we make you recover after you go through your treatments, and also being your partners. So Dr. Sofer is joined by Michelle Grant and Alan McNally. And then hopefully we'll have a panel discussion and Q&A, and Dr. Yu is joining us from Radiation Oncology. And then in the last few minutes, we have a really nice surprise. It's a video from our integrative medicine team that I hope you'll stay on at the end and listen to it. So with that, it's my pleasure to turn this over to Dr. Billingsley.
Thank you, Dr. Ahuja. And I think I'm going to ask my colleague, Dr. Balsazak, to lead off and give us kind of the big picture overview of where we are as a health system with our vaccination efforts. Thanks for joining us, Dr. B.
Yes, and thank you both for inviting me and the entire Smilow team, and I'm honored to be here. So as Dr. Ahuja mentioned, my role is the Chief Clinical Officer for the health system, and as such, I was given the responsibility for leading the efforts for the vaccine rollout at the health system. And we started that 3 days after the first emergency use authorization, so exciting, back in the second week of December. And we were lucky enough to get direct allocation from the federal government that week, and we began vaccinating our staff. As Dr. Ahuja mentioned, in the following weeks, we vaccinated first all of our high-risk staff at the hospital and across the health system, in our emergency departments, in our ICUs. And when I say we vaccinated our staff there, we vaccinated everyone who came in contact with patients in those units. Didn't matter whether you're an environmental services worker, a pharmacist, we tried to get everyone in as equitable a fashion as we can. And as Dr. Ahuja also mentioned, we're very proud that we are now at 80% of the entirety of our workforce. And that includes folks that work in billing offices and folks that work remotely even. And the clinical portion of our staff is much, much higher that's vaccinated, well into the high 80s, and in some cases, 90% of our staff are vaccinated. Dr. Billingsley is going to talk a little bit about some of perhaps the reasons why people are waiting. There are certain conditions where we want them to wait and delay their vaccine until some clinical milestones are met, and certainly some of our employees are falling into those domains as well. But vaccine hesitancy is real. It's something that we've spent a lot of time trying to assist folks in understanding. We have had an approach that I think has been one that many health systems and many organizations across the country have also used, which is we use appreciative inquiry, meaning trying to understand the reasons why people are not receiving vaccine. In some cases, it's because of an inability to use technology or an inability to get access to the technology to schedule. So we've put in efforts to overcome that, both with our staff, but also as we pivoted to the community, we noticed a lot of the same reasons in the community, including those kinds of access. Sometimes there are cultural barriers, and we have many coordinated efforts now across the health system to use many of the cultural interfaces with our communities that had been in place prior to COVID-19 for other reasons, like enrollment in clinical trials or reach out for cancer screening. And those work extremely well because I think we would all agree that when information comes from someone you already have trust in, someone you already have a relationship with, you're more likely to accept that recommendation rather than from someone you don't know or someone who you're just met. And so we've worked with those folks really effectively to try to drive across all of our communities that we serve vaccination acceptance. We, as you saw in those early statistics that Dr. Ahuja showed, between December 15th and February 15th, we opened up 8 large-scale mass vaccination sites and are capable of delivering more than 50,000 doses of vaccine per week. Unfortunately, the maximum we ever reached was 48,000 over a couple of weeks in a row, primarily in the beginning because we were not given an adequate allocation from the federal government. The way the allocation worked was the federal government decided which states got which percent, and for the most part, they did it by a straight population density. So we are about 3.5 million people in the state of Connecticut, which means we are 1% of the population of the United States. So we would receive about 1% of the production of each week's vaccine that the federal government allocated. And then the DPH did a very nice job, in my opinion, of making sure that there was equitable distribution across the state. So I think many people have heard the statistic that more than 75% of the population in the state of Connecticut has now received at least one dose of vaccine, and more than 55% of the state is fully vaccinated. I think not a day goes by, or certainly not a week goes by, where there's not a major piece of new information about either the disease, the spread, variants, vaccine, et cetera. And of course, two very big pieces of news this past week have been, first, the opening up of vaccine eligibility for the Pfizer vaccine to children as young as 12 years old. And that now will add another 174 approximately thousand individuals in the state of Connecticut that are eligible for vaccine. And we've opened up, as of yesterday, all of our sites to individuals as low as 12. And the second piece of information, which we'll talk about, and I think it's maybe caused a little bit of buzz just a short while ago, is the concept now that there is a really, I think, large carrot to earn when you get vaccinated, which is the CDC has altered its recommendation, suggesting that if you are fully vaccinated, and there's an important definition there, meaning that you have been 2 weeks after completing your vaccine schedule. So for J&J, that's 1 dose, and for Moderna and Pfizer, that's 2 doses, 21 or 28 days apart. You need to add 2 weeks to the final date of that vaccine, and then you would be considered fully vaccinated. So if you are in that state, the new recommendations by the CDC, in certain circumstances, importantly, not in a healthcare environment, not in mass transit, not on an airplane, if you're anywhere else, then you can, whether inside or outside, unless there are rules superseding it, you can not wear a mask. We can talk about some of the data behind that, and we can talk about that in the Q&A if there are questions, which I assume there is. So, the Yale New Haven Health System has given a total of 380,000 doses of vaccine to date, and we have fully vaccinated 180,000 people. So it's been an incredible effort. It's been many folks, I think, have either been vaccinated through one of our sites or volunteered or worked there. It's really, particularly the very beginning, was really exhilarating to be part of that, to know that we are finally doing something to beat this disease. And I'll speak from personal experience. It feels great to be vaccinated. I was finally able to see my fully vaccinated 89 and 88-year-old, respectively, for my mom and my dad, parents 2 weeks ago. So that was the first time in a year. So to be able to get back to those kinds of things are really exciting. Some things are not so exciting. My daughter's moving to a 5th floor walk-up in New York City on Saturday. So I'll be, unless someone wants to help, be carrying the mattress up those 5 flights of stairs, Kevin. I know you're pretty strong. You're a runner. But with regard to vaccination, so who's eligible right now? If you are above the age of 12, you are eligible. Dr. Billingsley is going to get into some of the caveats with that with regard to immunosuppression and stem cell transplant, which there are some. But one of the things that I'll end with before we can go, and Dr. Billingsley can talk a little bit about some special cases, is no discussion about vaccination is complete without a discussion of how are these variants, which are sometimes named after the place where they emerged, but increasingly being named by a number convention to try to avoid stigma of those places. But how are these variants how are these variants impacting our enthusiasm about vaccination? The short answer is while there's some evidence that at least some of the variants can in part, and there's a lot of, I'm parsing my words carefully here, evade some immunity. In general, the vaccine works to prevent most diseases in all of the variants that have thus far emerged. Now, it's important to understand that as long as there is widespread transmission of COVID-19 among large populations, the possibility of a new variant exists. So that is in itself a major point that would want us to pursue large-scale vaccination even more quickly. So that's one point I want to make. The second point I want to make, and this might be germane to the second part of these comments, is that there's also information suggesting that immunocompromised patients that have immunocompromisation because of something that they are on, because they have inflammatory bowel disease or rheumatoid arthritis and therefore take a immune modulating medicine, or they have an immune system disorder like AIDS, or they are immunocompromised because of chemotherapy, that they may be long-term reservoirs of the virus and therefore be ones that are more at risk of being spreaders. So that's new information that's coming out, and that may impact how we think about vaccination or other strategies in the future. But then that's very incomplete science. We don't really know much more than that, except that the virus spreads in a very uneven fashion. Let me stop there and ask Dr. Billingsley to give some specific detail with regard to cancer patients and cancer survivors.
Thanks very much. And I will echo some of those comments. It has been enormously gratifying to be part of this healthcare system as we have rolled out this vaccine effort across the state, not only for cancer patients, but for all of our patients and population around the state of Connecticut. And it has been remarkable to see the participation and the success. Could I have the slides, Renee? So one of the things that I will just start off by saying is many of our patients do have concerns about if they have not been vaccinated, are these vaccines safe in the setting of a cancer diagnosis or cancer treatment, or if they're in the immediate post-treatment follow-up period. And if I impart no other message this evening, I need to really reiterate the point that these vaccines have proven to be extraordinarily safe really for everyone, and certainly for our patients who have cancer or undergoing treatment or follow-up. And I would make the point that as our patients, people are particularly vulnerable to this infection. So the motivation to get all of our Smilow patients protected is high. I would also make kind of the side point that as members of the Smilow community, patients, family members, supporters, and those of us who are clinicians and caregivers, we all have a unique role and opportunity to serve as advocates for vaccination and engage those who may be fearful or skeptical. And I think this is part of keeping safe. If we can not only get vaccinated ourselves, but get our friends, family members, loved ones, and social circle vaccinated, we will all be safer. A couple of other key points bear emphasis. For those of our patients who are on active treatment, there is really no reason, with very few exceptions, to disrupt your therapy or treatment to get your vaccination. The vaccination should be easily sequenced in around your ongoing treatments. And vaccination is appropriate with really the entire spectrum of treatments that our patients are receiving. That includes traditional cytotoxic chemotherapy, radiation treatment, hormonal therapy, targeted therapy, immunotherapy, steroids, and surgical treatment. I have had a number of questions from patients over the past months as immunotherapy is becoming an increasingly prominent element in cancer care, would the vaccine blunt the effect of their therapy, or alternatively, would the immunotherapy blunt the vaccine response? The evidence overwhelmingly is no. These are safe and effective, and they can be combined without ill effects. Next slide, please. There are a couple of small but important key populations where we need to make some modifications around the timing of vaccination. Vaccination is still entirely safe, but the timing is related to sequencing the vaccination with the cancer therapy to optimize the protection from the vaccine. So patients with hematologic malignancies, and I'm speaking specifically about our folks with leukemia, lymphoma, to a certain degree myeloma, the timing of vaccination can be important. And some treatments may be delayed for a few weeks to perform the vaccination, and a few selected disease types which are slowly moving and indolent. Alternatively, some vaccinations will be deferred until after treatment if the treatment itself is immunodepleting and the treatment is of some degree of urgency. In those situations, it is, of course, even more critical that patients maintain the appropriate precautions of mask wearing, social distancing, and immunization of their social circle. Really important in these situations to speak with your hematology team. They are well aware of all of these timing issues and will work with you and your family closely to optimize the timing of your vaccination. We also, of course, are a significant center for hematopoietic stem cell transplants as well as cellular therapy. And by cell therapy, I'm referring to CAR T cells, which we're using for a variety of malignancies. For people who are undergoing these treatments or they're in their immediate post-transplant period, it is important to keep yourself absolutely safe and protected because the vaccination will be delayed for a period of time until the immune system is reestablished and recovered after these treatments. Again, very important to discuss the timing with your team. I think you can drop the slides. So the key points to take away are vaccination is safe. It's really only a few small patient populations where we need to be mindful of the timing, and please reach out and in a thoughtful way, as was described, engage friends, family, and loved ones in being a vaccine advocate. Thanks, folks.
Thank you, Dr. Balzasek. Thank you, Dr. Billingsley. We will save the Q&A for the end, and I'd like next to turn to Dr. Sofer and his team to give us an update on integrative medicine. Gary, you're on mute.
All right. Thank you all so much for having me. It's really quite a pleasure and an honor to get to talk to you today. I'm going to talk about integrative medicine. We're going to talk about what it is and what we offer at Smilow to help support you. But you know, I want to start with a little bit of a metaphor.
One more thing. Do you want to swap? I think you may want to swap the displays, and because what's showing is your.
Oh, is my presenter?
Okay. Yeah. Thank you.
You can see all my notes.
You just swap the displays. I think it'll work great.
This is above my pay grade.
I think hit the swap display, and it usually just flips it around. Hey.
Did that work?
No, but you see it on the top left, it says swap displays. Try that.
Uh-oh.
Try that.
How's that?
There you are. You're perfect. All right.
I keep saying that I'm turning into my parents when it comes to technology. It's a little disturbing, but that's okay. So again, I'm really honored, and it's quite a pleasure to get to be able to talk to you all about integrative medicine at Smilow what we offer and how we can support you through the journey. And I like to start off with a metaphor. I really stole this from another integrative oncologist, but it's an important one, and you'll also see it repeated in the video later. And I really want you to think about your cancer as a weed. And when this weed grows, it really becomes everything that you can think about. It consumes your life, and it becomes your focus. And your oncologist is phenomenal at dealing with this weed. And the doctors at Smilow are some of the best in the world to really take care of it and help you through that process. But and we know that there's so much more to you. And there's this garden that really surrounds the weed, and it's easy to forget about that garden. And we're here to help nurture it. And so what do we think about? We think about turning our attention back to the rest of this garden. And how do we make the rest of this garden flourish? And really, how do we make the soil inhospitable to more weeds? So how do we even kill the weed without necessarily focusing on the weed itself? And we want to build that for you. And if that metaphor didn't really capture you, I can put it simply. It's really the best of what kept people well for thousands of years, combined with the best of what keeps people well now. It's really about making you feel better, whatever that might mean for you. And it's about meeting you where you are. We have a huge toolbox to pull from. And so for some patients, that might mean yoga and meditation. And for other patients, that might mean nutrition and fitness. But we're here to support all of that. Just want to go over some definitions, because we're not an alternative. We're not alternative medicine. And alternative medicine is really when you use a non-mainstream practice in place of your conventional therapy. And we don't really consider ourselves a complement, because complement is simply a complement, a little addition. And what integrative medicine is really about is bringing together these conventional therapies that you're getting with the complementary therapies in a coordinated way. And our role in our department is about coordinating that for you. And so some of the modalities that fall into integrative medicine, and some of these may be familiar to some of you and some of them may not be. Things like biologically or nutritionally based therapy. So that may mean diet or nutrition. It might mean vitamins. It might mean fitness and physical fitness. We have mind-body interventions like meditation or yoga or biofeedback. And then there's manipulative or biochemical therapy, such as massage therapy, which we offer here. And then you have a whole realm of energy or spiritual practices. And so that may mean connecting with your religion or connecting with your faith, or it may mean something like Reiki. And then there's entire alternative medical systems, which we don't take part in, but we pull from, and we bring them into your care. And so this is our absolutely incredible team of practitioners. We have massage therapists, we have yoga practitioners, we have Reiki, people trained in Reiki and meditation. Again, all to help you through your journey. And so what do we offer? One of the great things that we offer is oncology massage. And this is really specialized massage therapy that's focused on the patient who's going through cancer. We offer this inpatient and outpatient, and it's been shown to improve side effects of chemotherapy, but also reduce pain, promote relaxation, and boost your mood. I always feel better after I get a massage. Reiki, so this is a light touching therapy or even a non-touch therapy that comes from the Japanese tradition. And it promotes relaxation and stress reduction. And this is also something that we offer. Dana Brewer, who's part of our team, has created this beautiful and robust creative expressions program. And I would urge you after we're done today to go look up Smilow Hearts and Smilow Rocks, which are some of the projects that she's done. And what these are, collaborative installations, group projects where our patients or our doctors all come together and participate in some form of creativity or art expression. What we've done beautifully, and I can't take credit for it, but we've really pivoted quite well with COVID towards virtual classes. And we have a whole slew of live online classes offered throughout the week. And then we have a big, giant video archive that's available to you free of cost at all times. Some of the classes that we offer are gentle yoga, restorative yoga, and that's more about sitting in relaxing poses for extended period of time. We offer Tai Chi, which you can see on the upper right of the screen, which is a martial art, and it's based in the Chinese tradition. We also offer a bunch of meditation opportunities. So whether that's guided meditation or a beginner's class, or we also offer phone meditation one-on-one. The most important thing that you know is that no previous experience is required. All bodies, all types, all abilities are welcome. And we really think that every person at every level of experience can get something out of this. And then finally, we offer an integrative medicine consultation, and that's a one-on-one appointment with me. And together, you and I, we create a comprehensive plan that involves your nutrition, your physical fitness. We think about mind-body modalities and learning meditation practices. We talk about your spirituality, your religion, and how that plays into your care. What we've also created, which is really exciting and new, is for those patients who feel the need to be on lots of supplements during their cancer treatment, we're working with a pharmacist and a dietitian to make sure that those supplements are safe and not going to interact with your chemotherapy or other medications that you may be taking. So how do you stay in touch with us? How do you stay on top of things? Well, we offer a weekly email that updates you on all the classes that we're offering. We also, again, have this wonderful video archive. And you can reach out to us, and Gisla's email is on top there, and I'll leave it at the end. And to get a consultation with me, I always ask that you talk to your provider first, but if you want to call directly, the phone number is there. And we have lots of virtual events that are available to you. And that's it. So thank you so much again for giving me the time. I hope we can really contribute in a meaningful way to the journey that you're on. Thank you.
Thank you, Dr. Sofer. That was an amazing set of offerings. I know there are lots of questions for all of you, and there were also questions sent earlier to Renee by our patients. I'm going to sort of probably ask all of our panelists, including Dr. Yu, who's joining us from radiation oncology, and perhaps can give us an update on the recent news around Electa. So Dr. Balzasak, I think we're starting with you first, and there's a question up here. The CDC today announced relaxing indoor masking, as you mentioned, and Governor Lamont says the state will follow suit on May 19th. How is the health system planning on managing that? You didn't think you were going to get off easy tonight, were you?
Certainly not. You know, I think that as I said a few moments ago, you know, the information has really evolved on every level for every aspect of the pandemic, and it will continue to evolve. And what we saw today was Dr. Walensky at the CDC has given the entire country a benefit if you are vaccinated. However, in a healthcare environment, that benefit does not apply. She was very clear, Dr. Walensky was very clear to say that this mask mandate continues in healthcare environments. So that means for all of us who work there, and it means for patients and visitors if they come there. I think it's going to be some time before that gets relaxed, even though we are the staff, that is, employees and medical staff are some of the most vaccinated individuals or highest density of vaccinated individuals in the world right now. But still, because the fact that there are patients among us in the possibility of spread, and the fact that there are vulnerable individuals because of the immune modulation and other things that Dr. Billingsley mentioned, we will continue to have the mask wearing required.
Thank you, Dr. Balzasak. As you mentioned, it is a complex but evolving equation, and I know you keep us informed. Dr. Billingsley, I have a question for you. I think this is around a vaccination, and this patient asked, I'm most comfortable being administered vaccine through my Smilow care team as they best know me and my treatment plan. Will this be an option? So I presume they mean if they come in for their treatment, can they get their vaccination at the same time?
That's a great treatment or great question and an appropriate question regarding integration of vaccination with the treatment. I will explain that we have been partnering with all of the vaccination sites established through the health system, and we are actually encouraging our patients to get their vaccination at the standard vaccination sites. And we recognize the fact that in some ways that is less convenient than coming to their traditional site of care. And we like the fact that people feel comfortable in our sites. But one of the things that we are working to do is continue to keep our patients as safe as possible and kind of keep the flow of unvaccinated individuals as low as possible through our clinical care sites. Our teams are available to you, however, to help you find a convenient site for your vaccination.
Kevin, just hold on there. I think you just got a comment that going to a vaccination site puts the patient at risk. How do we respond to that?
You know, I know that is a concern. I think most of the vaccination sites are, at least those in our system, are using all of the appropriate precautions to keep every individual coming through the site safe and secure. And they have good protocols and practices and infrastructure set up to do that.
I'm going to reiterate that. I think Dr. Balzasek started the evening with commenting around the euphoria around going to these sites, but also the community and how everyone looks out and keeps people safe. I've had taken my family members to these sites and I found the same feeling. They're absolutely wonderful. It's the sterility, it's safe spaces. So I think this is the best way of sort of delivering the vaccines, given especially the precautions and handling. Dr. Sofer, you had a lot of questions around the services and how do we get access to those services? I think I'm seeing that question again and again. And I know you had some of the comments around the website, but can you give a little bit more detail on how people can get access these services?
Sure. So really, if you just Google Smilow Integrative Medicine, it'll come right up and will be available to you. We also have Ellen here, who's one of our yoga teachers, and we have Michelle, who's one of our massage therapists. Maybe they can offer something.
Sure, Gary, thank you. Regarding massage, if you or a family member are an inpatient, you just ask somebody from your medical team to put a consult order. It will come directly to our head coordinator, and then we can get you set up for massage. If you're ambulatory, you can come into the York Street campus and do that the same way. We can schedule you an appointment for a table massage. So again, just ask somebody from your medical team for a consult order, and we can get that going fairly quickly. And our online programs are available either live when we do them through our calendar, or most of them are also recorded. So as Gary said, if you Google either Yale Cancer Center archive, video archives, or Smilow Integrative Medicine, you'll find all of our online programs that way.
And Michelle, it sounds like you need a referral. Dr. Sofer, someone asked the same question. Do they need a referral from their oncologist to get a consult with you?
Not necessarily, but I think it's the best path forward so we can work collaboratively.
Thank you, Dr. Sofer. And cancer survivors can also come in, right? It's not just people.
Of course, any current or previous patient of Smilow.
Right. I think that analogy of the garden, right, bringing the healing garden, that was great, and I think a lot of people resonated with that. And Renee typed in the website address also on the chat box. So thank you, Renee. Just so, as Dr. Sofer mentioned, just type in your favorite search engine, Integrative Medicine Smilow, and pops right up. So thank you for all that. Dr. Yu, I want to come to you, and maybe you can tell us a little bit about the radiation oncology services, how they are in the system and are meant to really provide care to patients closest to home. So maybe you can enlighten the patients a little bit about the radiation oncology program.
Sure. Well, radiation oncology is one of the, pillars of treatment with surgical oncology, medical oncology, integrative medicine, and we all work together as a team to treat patients who need radiotherapy. We have satellite locations as far south as Greenwich, all the way up to Waterford, we're traditionally seen after a patient sees a medical oncologist or a surgical oncologist, but in some situations, we're seeing immediately a diagnosis for certain indications like prostate cancer. Radiation oncology has made great strides over the last couple decades, and so it's become a very, very technologically advanced treatment that requires a big team. I'm happy to take any questions about our department, so the challenges that we've been through, and the bright future that we have as well.
Thank you, Dr. Yu. And I know that recently there was some information in the news around the Electa system, but I believe all our systems are back at go, and all our patients are doing really well on treatment.
Yeah, I mean, briefly, what happened was the Electa Mosaic system is a record and verify software system. And what that means is it's a system that's used by the entire radiation oncology department to keep track of radiation treatments. It manages the transfer of electronic treatment plans from planning software to the actual machines, and serves as our radiation oncology chart. On April 20th, Electa Mosaic went down nationally, over 40 sites, and we were immediately unable to access the information in the cloud. And we were unable to use our linear accelerators, which are our radiation treatment machines. So later that evening on April 20th, we thought it was just going to be a brief outage, but it became apparent that it was nationwide and it was severe. And at that moment, Yale Information Technology and Physics jumped into action and worked through the night. On the next day, on April 21st, the Physics and the Information Technology team informed us that they had developed a workaround. This workaround, I want to emphasize, does not use a cloud system, but is intentionally labor intensive, and is done with 3 radiation therapists, a physicist, and an MD present at the beginning of every treatment. And all subsequent treatments were administered with particular care, knowing that the electronic record and verify system was not there. And so multiple checks and timeouts were performed in a very labor intensive way as we tried to adapt to this new reality that our cloud system was down. I think at present time, Dr. Ahuja, you're absolutely right. We're making our way back through the Herculean efforts of our physics, dosimetry, and information technology staff. We have performed work that traditionally takes months over the course of weeks. We have set up a newly built on-premises version of the record and verify system, but work continues behind the scenes, utilizing both the manual treatment as well as this new system. I hope patients haven't noticed, because we're trying to do as little disruption to their care as possible. And this is happening during a time of increased patient volumes, as shown in that slide by Dr. Ahuja. And I do want to say, as we emerge from this, we have a couple exciting technology developments you'll be hearing about in the future. I'm going to tease right now, and I couldn't be prouder of our faculty, our staff, and I hope everyone listening is feeling some hope around COVID, and feeling a little hope for us in radiation oncology, that we're going to emerge stronger and more nimble. And I think the future is bright, not only for us in our department, but also for this hospital.
Thank you, Dr. Yu. I'm going to pivot back to vaccination. There are a couple of questions. One, and I don't know if Dr. Balzer or Billingsley are going to answer, it's around allergies. It's allergies.
I can answer it. I'm a board certified allergist.
That's true. Of course, Dr. Sober, how could I
didn't
forget?
think I'd get pulled into the COVID questions, but I'm happy to answer it.
Well, whoever wants to have allergies are raging. Should you get your vaccination if your allergies are raging? That's on the chat box. Whoever, and of course, Dr. Sofer, since you volunteered, would you like to answer that.
Sure. The short answer is absolutely. Allergies are not a contraindication to getting your vaccine, and it shouldn't be a reason to delay your vaccine.
I think Dr. Billingsley said it, right? Can't get your vaccination and all that. I remember that from tonight. But another follow-up, and this is maybe a little bit more detailed. This is a patient who asked that, is there one vaccine better than the other that I should get? In terms of, we have choices. We're fortunate to have several choices. Would either of the Dr. B's like to comment on the choices?
We can compare our notes openly. I think someone from the CDC said this best, I think, a while back. The best vaccine is the vaccine that's available to you.
Exactly.
We have seen, I will report to you, since the pause of the J&J vaccine because of the blood clotting issues, the state has stopped receiving J&J vaccines simply because we're all awash in it. We have many thousands of doses of J&J that patients have just not gotten. We are happy to give it, but because when we open up our mass vaccination sites and the J&J is the vaccine of the day, we just don't see people show up. I think that if I was given a choice between J&J and nothing, I would absolutely take J&J. The risk is about 1 in a million of this blood clotting event that happens between 6 and 14 days after the vaccine. And it happens almost exclusively in women of childbearing age. So there is a safety issue that's certainly with J&J, but it is something that that's knowable and you can monitor for. With regard to Moderna and Pfizer, they are essentially the same vaccine. They use the same sequence. They're slightly differently packaged, but the way they operate in your body is the same. I would consider them exactly the same. All of them are excellent. I mean, just absolutely outstanding at preventing severe disease or death. I don't know, Kevin, if you want to add anything to that.
I have very little to add to that. I would underscore the point that the real rub is getting the vaccination. That's where we're all going to get value. And I will say that there is soft but emerging signs in cancer patients that 2 vaccines may have some negligible incremental immunogenic benefit over a single dose vaccine, which would obviously be the J&J. It is hard for us to know if that is clinically significant, and I want to be very careful about how I frame that to this audience, but I will share that is something that is emerging in our circles.
Thank you, Dr. Billingsley. Dr. Sofer and your team, back to you. I think there's a lot of interest on the chat on, hey, listen, can the patient's families get the treatments, or do you have to be a patient to get this treatment? And alongside, a lot of like, maybe let's advertise your services more. I didn't know about this. So I think this forum is exactly, we're raising awareness, but can patients' family members get these treatments also?
Speaking to massage, the massage is just for the patients and survivors. The other programs are open to family members, such as the online programs. Anybody, family members, staff, the community can log in and do the meditation, can do the yoga, can do the Tai Chi. And the creative arts programs are also open to everybody. They're open to the community, they're open to family members and patients as well. So it's really just the massage. The hands-on work is limited to patients. There's no charge. Table massages, you can come in for 3 of those, and the inpatients get the treatments while they're there at the hospital as needed.
Thank you, Michelle. You answered one of the questions on, are these massages free? And then the other question is, are the other integrated medicine services billable requiring insurance authorization?
Not as of right now. So we're
Wow.
seeing everybody.
Okay. And I think you're also seeing for your value for your services, a lot from the caregivers asking for these services. So I think this is really
So-
exactly the reason for this format. So we hear from our patients and their families as they go through this.
So
Dr.
you know, again, your family is part of that garden. And so we recognize that treating your family and involving your family in your care is paramount to making you feel better. So the video archive is absolutely accessible and available to them, and a number of other services are absolutely available to them. And if we can support them in any way, we will.
May I
Go ahead, Ellen,
insert
please.
something here? Yes. The yoga classes are available both to patients and their families. And the beauty part of the Zoom classes is that people don't necessarily have to participate if they feel unsure about whether they want to try yoga or their capacity. If people are brand new, they might like to start with restorative yoga because that's done primarily on the floor, though sometimes we do some standing stretches just to get some of the kinks out. But the other part is everything is, I have a background in trauma-sensitive yoga. So the language in trauma-sensitive yoga is very different from what I would call regular yoga classes, which is more directional. So everything is done by invitation. It's all choice-based. I always ask at the beginning of class, you know, is there something special you would like to do, an area of your body that you would like to work with? Knowing that, you know, all of my students have different health conditions. So some people can do some things, other people can't do other things. So I try to create an environment where people feel comfortable making the choice, maybe to do something differently or even not to participate. That's, you know, totally fine. So, and I really hope that people will sample yoga because it has so many benefits for stress reduction, relaxation, overall sense of well-being, just, and also we have managed to create over 14 months a very, very robust community of yogis. And sometimes they're pets who come to class. So there is a sense of camaraderie and, you know, people talk about other things, you know, other than cancer. And I like to create that kind of environment where people have something that is nourishing to them and supportive and just fun. So please
you.
come.
I think you will be getting it'll be busy tomorrow. I can see that from all the interest in the services. I think there's an ask for services in Trumbull. Are these services available at Trumbull site, folks?
Yeah.
I'm seeing a lot of head nodding. That's wonderful. Switching to, go ahead, Michelle,
I was
please.
going to say on the St. Wakefields campus, on the York Street campus, Trumbull, and we had to take a pause on some of the care centers due to COVID, but that should be starting up hopefully at some point in time down the road.
Perfect. Let me pivot to perhaps some more questions around vaccination. A question here, if someone's fully vaccinated and it says previously infected with SARS-CoV-2. So I think it sounds like they had both COVID and they are vaccinated. Can they be reinfected? I see Dr. Balzak maybe ready to answer that question. Go ahead, Tom.
So there have been sporadic reports of people who have had vaccine breakthrough, even among people who have had both COVID and the vaccine. But what's important to note is that those people are very well protected against severe disease and death. So it's possible. There is some scientific evidence to suggest that they will be less likely to infect other people because the duration of their disease is less and the amount of virus that they shed through their nose is somewhat less. But most importantly for that individual, the vaccine does confer additional protection. And even if there's breakthrough, they are much more likely to avoid hospitalization or die.
Thank you. And Dr. B, there are lots of Billingsley, there are a lot of questions on timing and efficacy, and I think there are probably two details. And but broadly speaking, there's a question on should you wait 4 months? Is my immune system strong enough? Again, for most people, it's fine, but obviously they should talk to their doctor. Is that your recommendation to their team?
That's exactly right. And this is where it is, it really is individual by individual. Some of these lymphocyte depleting therapies are the backbone of treating hematologic malignancies. They are the treatment people need for cure or disease control. But there is a period of time during which we need to wait for the immune system to recover, and that is going to be a somewhat variable period. 3 months is often something that we hear about, but it is going to be quite person specific. So conversation with your care team.
Thank you, Dr. Billingsley. And I know it's almost the top of the hour and there's some questions I probably won't get to, but I think this is important to perhaps talk to the audience today. What is a typical care team? You know, can you tell me, doctors, nurses, what are their roles? Maybe Dr. Billingsley would be helpful to talk a little bit about the care team at Smilow.
You know, I would be happy to do that. And I think that to the point of your introductory comments relating to the excellence and the dedication of our nursing teams, most of our care teams consist of a group of medical specialists, including both physicians as well as advanced practice providers, who can be either physician's assistants or advanced practice nurses. And those individuals form the primary clinical teams, but they work hand in hand with our partners in nursing to solve problems, answer questions, kind of arrange the continuity of care and cover those gaps that can occur as patients and families transition through cancer treatment. In addition to care teams, in addition to physicians, nurses, and advanced practice providers, there are an entire range of professionals who also add significant value and improve the patient experience. That includes people like our teams in nutrition and dietetics, our folks in physical therapy and occupational therapy who support the care of our patients, both in the outpatient and inpatient spaces, our social workers and our mental health providers, and of course, the group on this call, our integrative medicine services. So I think the term team is quite broad, and there will be different members of the team in play and front and center depending on where people are in their cancer journey. But the real healing comes from all of us coming together with patients and families at the center.
Thank you, Dr. Billingsley. I know it's almost the top of the hour. I want to thank all the panelists for sharing information. As I started and said in the beginning, that we hope we can keep these as frequent ways of getting together. So if you have other ideas for future patient and family forum topics, please email your questions to cancersanswers@yale.edu. You can also follow us up on Facebook, Twitter, Instagram, YouTube, all the channels. And of course, for the many, many questions on integrated medicine, I hope you will log on and see all the offerings there. Stay on if you have time, and I apologize if I didn't get to all of your questions. I hope we will continue to answer this, and I hope you'll continue to come back and connect with us and share your feedback with us. As I mentioned, there's a lovely video by the Integrated Medicine Service.
I had felt a small lump in my right breast and ended up finding out that I was being diagnosed with breast cancer. It was a stage 3, pretty aggressive breast cancer.
And the year after I retired, I went for a test, and the doctor said, we see something on your lung. It looked like ground glass. I was diagnosed as stage 1 at the time. It was a trauma. When you get that diagnosis, you're hit right between the eyes. It's very difficult.
At that time, I had 2 girls, a freshman and a senior in high school, and just kind of the unknown. What comes next, and where am I getting the help, and what are my options?
Here at Smilow, we have cutting-edge disease-focused treatments that patients come to get cures for their cancer. The integrative medicine program focuses on the human side of the patient. What I see with my patients who use integrative medicine services is a sense of being able to reflect, to be able to express themselves, or be able to get physical relief from the services that are provided.
One of the best ways to describe integrative medicine, especially in terms of cancer care, is if the cancer is a weed, your oncologist is phenomenal at dealing with that weed. They can focus on it. It's really our job to focus on the rest of the garden. Build the flowers, make sure that the soil isn't hospitable to the weeds anymore.
I went through chemo and the surgery, and I went home. And I languished for about 6 years, just sitting around home, feeling whatever, sorry for myself or whatever. And then I met Dana Brewer.
One of the highlights of being an integrative medicine practitioner is that I get to go upstairs and engage with patients that wouldn't normally choose integrative medicine because maybe they are unsure of what we offer or they haven't heard of it. We do yoga classes, we have Tai Chi, Qigong, we have meditation classes, Zumba classes. We do huge creative expression, collaborative projects, and individual projects. We have massage, we have Reiki, and when I say there's something for everyone, there really is, because at the very, very least, there's breathing, and there's breathing exercises, and there's just ways to help alleviate stress and feel better.
Many of these services are offered online or through Zoom or through phone-based treatments. My patients love the fact that they have all these different services to choose from that's provided by the integrative team.
When I met Dana, she indicated Smilow wanted to make 1,000 white birds as a project, and if I'd like to participate and learn how to make that. And I jumped at the opportunity. There was a doctor from Malaysia. As a boy, he wove fishing nets. He took the 1,000 birds and wove them into a fishing net. And it was displayed in the Smilow lobby for the longest time. And then they took it down and cut the birds out and gave those birds to the cancer patients. And that, now that I think about it, that was really the impetus for me wanting to do it. It's kind of like planted the seed.
Sometimes it's just simply about experiencing joy again, because they've become so used to this pattern of chemotherapy, feeling ill, feeling sick. But if you can give them these nuggets of happiness, then you can really transform their journey and who they are and who they become. And so everybody's always seeking to be happy. Once you get the weight of cancer on your back, it's so much more challenging to go into that place. But that's the strength of integrative medicine. We give the patients those tools to get back into that place.
The support really raised me up. It gave me so much strength to clearly battle, both for physical pain, but just my emotional well-being. As much as I wasn't a yoga person, and maybe still am not, I looked forward to going there. I looked forward to the conversations that were held. I looked forward to the praise that was given for small little gains from week to week. I just looked forward to the comfort, really, that a lot of the programs provided me.
Integrative medicine is another layer of support for patients going through treatment and beyond to help them achieve that hope and optimism and that connected feeling that they need.
When I walk into the room, I'll say, hello, my name is Desi. I'm a volunteer here, and I'm a 13-year cancer survivor. During my time here, I learned how to make origami birds, and today I make them for cancer patients and other nice people. Will you accept this for me? I couldn't give them away fast enough because I would get this shot of dopamine in my brain, and I'd walk out of the hospital like 6 inches off the ground. I think I gave 2,000 birds away in 2018 and 19.
I'm reminded daily that I'm a cancer survivor, but I find that I'm incredibly resilient, and And I believe that I am due to the strength that I gained from those people that I met along the journey. I was fortunate enough to have a great support system already in place with my family and friends and my community, but I think I gained more strength as well from the doctors and nurses and the staff in the integrative medicine department and just the people that I've met through becoming involved with the Looking Forward fashion show. It continues to show me the importance of the program and of giving back.
Every dollar that's donated ends up affecting countless patients, providers, and family members that we can't even imagine.
We're a growing and developing program, and we need support. We need help to create that. We really do rely on the support of people to help us grow and help us thrive.
He started with the integrated services. He just changed like that. He was the old Desi, very positive and very up. And without the Creative Expressions program, I think he would not have been the man he is today. I really don't. I think he would have went into a deep depression. It was a godsend.
So what good is treating them on physical level if you leave the emotional and spiritual level untouched? This touches that. This gives us a chance to heal completely.